Today we will study insulin and oral hypoglycemic agents. So from this title you will know we will use drug to treat which kind of disease? Yes, diabetic mellitus. At first we studied about pancreatic cells. For example, we know pancreas, it is one of the endocrinal gland, and at the same time also is the exocrinal gland. Endocrinal gland can release some hormones such as insulin, glucagon, and somatostatin. In pancreatic, the beta cell can release insulin. We also call beta cell B cell. And for diabetic mellitus patients, their insulin insufficiency because their beta cell function reduced. A cell or alpha cell in pancreas, it can release glucagon. Do you remember the major function of glucagon? Increase or decrease glucose level? Increase glucose level. And in pancreas also have D cell can release the third hormone. Do you remember somatostatin promotes growth? Endocrinal gland also can release these hormones, mainly regulate glucose level. So we know the major function of insulin to reduce blood glucose level. That means if in the patients their glucose level increase, insulin insufficiency can induce which kind of disease? Diabetic mellitus. So let's know something about diabetic mellitus. What's the meaning of diabetic mellitus? Is one of the metabolic disorder characterized by relatively or absolutely insufficiency of insulin and the resultant disturbance of carbohydrate metabolism. Here we have two words. The first word is relatively. What's the meaning? That means beta cell can release insulin, but insufficiency. Later we will study the second type, NIDDM patients. These patients, their beta cell can release insulin, but relatively insufficiency. The second word is absolutely. So what's the meaning of absolutely? Couldn't release insulin. So why? Because beta cell be destroyed. And for example, the first kind of diabetic mellitus patients, IDDM patients, their insulin absolutely insufficiency. So we divide diabetic mellitus patients into two broadly categories. The first kind, few patients, about 5 to 10% diabetic mellitus patients, they are the first kind. We call them insulin-dependent diabetic mellitus, IDDM, the first type, and we also call them serious diabetics. For this first kind of patients, whose pancreatic beta cells are destroyed by an autoimmune reaction, leading to a completely lack of insulin. So their insulin insufficiency is the absolutely insufficiency because beta cell be destroyed. That means if we give some drugs, stimulate beta cell, could the cell can release insulin? No. So insulin is the only agent to treatment of the first kind of diabetic mellitus. Compared to the first type, the second type, most diabetic mellitus patients, they are NIDDM. The second type is non-insulin dependent diabetic mellitus. Non-insulin diabetic mellitus patients, which is caused by multi-factors, such as family history, such as dietary, such as the environmental factors. And most patients, this can't. Caused by multi factors, including pancreatic beta cell defect, reduction in tissue sensitivity, and the role of environment. Their insulin insufficiency is the relatively insufficiency. So what's the meaning? Oh, if we can use some drugs, stimulate beta cell, yes, still can release insulin. So different treatment method of IDDM from IDDM. And NIDDM patients, at first, they only need to control their appetite or do aerobic exercise after the dinner, after the breakfast, 30 minutes. And yes, they can control their appetite. They can reduce their glucose level. Most patients, they control the glucose level 2 to 3 years because their beta cell continuous function reduced. So several years later, their glucose level will increase again. And that means we have to give the drugs. So we give them oral hypoglycemic drugs. And some patients, later, they will have complications or they will have other disease. So at last, we will give them insulin. Understand? So today, we use the drugs to treatment of diabetic mellitus patients includes these kinds. The first kind, the most important drug is the insulin. And the oral hypoglycemic agents also includes sulfonylureas. The second kind, biguanide. And then the third one, serotoninase. The last one, alpha-glucosidase inhibitors. So let's study them one by one. The first kind, very important drug used to treat diabetic mellitus patients is the insulin. So insulin we have known, and our pancreatic beta cell release insulin. The major function reduce glucose level. Insulin is prepared commercially from bovine and porcine pancreas. So at first come from animal resources. But animal resources have questions. Porcine pancreas insulin, one amino acid different from human insulin. And the bovine insulin, 3 amino acid different from human insulin. Oh, different from human insulin. Maybe means this animal insulin will induce one adverse reaction is allergic reaction. And the second one, we can use human insulin. So insulin this year can also be produced by semi-synthetic method and recombinant DNA techniques. We have human insulin. So human insulin, same with human insulin, no allergic reaction. So that means if your patients use animal insulin, you should suggest them change into human insulin. And chemistry of insulin. In biochemistry class, we have known insulin consists of 2 amino acid chains. One is this chain, the other one is this chain. So these A and B chains joined together by disulfide linkage. Insulin has a lower molecular weight of 51 kilodalton. And the third one, insulin is destroyed easily by digestive enzyme. What's the meaning? Could we oral administration insulin? No. So we have 2 injection. And which kind of administration method is the commonly used? Subcutaneous injection. So the usual route of insulin is subcutaneous injection. And in fact, the patient is painful for this reason. So if you can solve this question, this problem, and very useful for our patients. And the patients have to injection insulin. So we can use intravenous injection or intramuscular injection. The usually commonly using method is in subcutaneous injection. The right sides are injection sites, such as forearm, foreleg, and ventrous antral here. And the patients use this injection sites. This year, most patients, they use insulin pen. So it looks like this pen, look like your pens and your ball pen. And the patients use the insulin and then regulate insulin doses, unit, 20 units, and then subcutaneous inject the drugs. Very easy, convenience, and easiest for the patients. This year, still some patients use insulin pump. In clinic, have you seen this insulin pump? Very useful. And we call this artificial pancreas. So what's the meaning for this? Very useful and can regulate glucose level in time, but expensive, yes. So in the future, I think most patients, they can use insulin pump. And insulin pharmacological effects, physiological function. What's the meaning of physiological function? We use low doses insulin in our body. And then we give the drugs pharmacological effects. How these effects? The first one, hypoglycemic action, reduce glucose level. The second one, action on adipose tissue. The third one, action on protein synthesis. And number 4, regulate potassium, increase intracellular potassium. And the last one, promote growth. So let's study them and review them one by one. The first one, increase the first pharmacological effects, reduce glucose level, hypoglycemic action. Insulin can regulate glucose transport, stimulate of glucose transport into muscles and adipose. From these pathways, the first one, increase glucagon synthesis and reduce blood glucose. And the second one, increase glycolysis, so reduce blood sugar level. And also inhibit gluconeogenesis. What's the meaning? This you studied in biochemistry. Other substance change into blood sugar. And the second, pharmacological effects, action on adipose tissue. Insulin can reduce circulating free fatty acid and promote triglyceride storage in adipocytes. The mechanisms can induce of lipoprotein lipids and also promote lipoprotein transport, inhibit of intracellular lipids. So now I have a question. For diabetic mellitus patients, they will have a serious complications, acute serious complication. And for this reason, insulin insufficiency and the insulin's physiological function reduce circulating free fatty acid will increase. So what's the meaning? The acute serious complication is ketoacidosis. The reason is here. And the third, physiological function and the pharmacological effects of insulin, action on protein synthesis. Insulin can stimulate amino acid uptake, increase protein synthesis, and inhibit protein degradation. So at last, insulin increase protein concentration. And number 4, the fourth effect of insulin can regulate potassium. Insulin facilitates the uptake of potassium by cells, resulting in lowering of the extracellular potassium concentration. The reason probably due to the increased activity of sodium potassium ATPase. So we have a question. If the patients use insulin, increase intracellular potassium, what's the meaning? Means that reduce extracellular potassium. That also means later we can use insulin to treatment of hyperkalemia. Yes, excellent, hyperkalemia. The last effect of insulin can promote growth. Why? That's now we mentioned. Because insulin can promote protein synthesis, fat and ribonucleotide synthesis. So, what's the meaning? For IDDM patients, for which kind of IDDM patients? Most IDDM patients, they are young children. So for young children, their insulin insufficiency. So failure to grow is a symptom of diabetes in children. Just now we studied insulin's physiological function and pharmacological effects. So let's use insulin to treat disease. And today we want to treat diabetic mellitus. And just now we have known diabetic mellitus patients divided into two broadly categories. So the first case, few patients, they are IDDM. The first case, insulin-dependent diabetic mellitus. For these patients, insulin is the only urgent. Why? Because their beta cell be destroyed. We have to give them insulin, and as the only urgent. Most patients, they are the second type. We call them NIDDM, non-insulin dependent diabetic mellitus. And in clinic, you have known the patients have the NIDDM, not very serious. They control appetite, do exercise, or they use oral hypoglycemic urgence. They don't use insulin directly. So which kind of NIDDM patients, they should use insulin? The first one. NIDDM patients, the second type of diabetic mellitus patients, they control their appetite failure. So they can you can suggest them use insulin directly. All the patients, I want to use oral hypoglycemic urgence. And then they use oral hypoglycemic urgence, couldn't control their glucose level successful. So they have to change into insulin. So the first clinical using of insulin to treat NIDDM patients, appetite control or oral hypoglycemic drugs used failure and change into insulin. Second patients in NIDDM, they have acute or serious complications. We know diabetic mellitus patients, and in the future, for example, 10 years later, 60% of them, they will have cardiac myopathy. They will have 12 years later, 60% of them, they will have diabetic nephropathy. And the first complication is diabetic retinopathy. The patients will tell you, doctor, I have blurred vision. And the main reason, because they have complications. So here we know, in NIDDM patients, why they should use insulin? You should suggest them use insulin directly because they have acute or serious complications. And these are indications of patients use insulin. And the third one, in NIDDM patients, they are accompanied with infections. They have serious infections. You should give them insulin. Or they will do the surgery, operation. So as a doctor, you should know the glucose level very high. You couldn't do the surgery for your patients. Why? High glucose sugar means the hearing rate retarded. So you couldn't do the surgery for your patients. You must use the drugs. Use which drug? Only insulin. Insulin reduces the glucose level. And the FBG, fasting glucose level, normal or less than 10. Oh, you can do the surgery to your patients. Don't forget this. Because hearing retarded and operation patients, they should change the drug into insulin. Maybe most of them, they tell you, oh, doctor, I use the oral hypoglycemic agents, control my glucose level. Very good. Why I should change into insulin? Because some drugs inhibit coagulation, maybe promote bleeding in the surgery. So must change into insulin, and then you can do the surgery. For another example, such as ketoacidosis, that's now we see the serious patients, and you should reduce the glucose level quickly. So change into insulin. And post-pancreatectomy diabetes or gestational diabetes. Do you know gestational diabetes? Diabetic mellitus patients with pregnancy. So the patients, this pregnancy, you must suggest them use insulin. Some of them, oh, I am pregnant. I don't want to use insulin. I want to oral administration drugs? No. Gestational diabetes, they should use insulin directly. They couldn't use drugs because drugs have lots of adverse reactions. Insulin, our pancreas beta cell release insulin. It's normal, okay? So the patient's pregnancy, they can use here, for an arm or for a leg, inject insulin. And just now we also mentioned insulin can increase intracellular potassium. So we use for treatment of intracellular potassium deficiency and hyperkalemia. Just now you have given us the right answer. So now we should know insulin the adverse reactions. Diabetic mellitus patients, they use insulin will have these adverse reactions. The first one, hypoglycemia. Second one, insulin allergic reaction. And the third one, very difficult problem. We still don't know how to treat insulin resistance. And insulin resistance also includes acute resistance and chronic resistance. The last adverse reaction of insulin is the local reaction, lipohypertrophy.